So there's a very important component of our care when we're working with someone, and that's removing inflammatory triggers, removing the things that got somebody to the place where they're at in the first place, or what's keeping them there. I've got one patient I've been working with for quite a while right now. Usually a lot of people will see something budge in the first couple months. This person hasn't seen really anything budge for closer to 12. And that really had my head scratching, right? So I said, okay, let's look at the guts. A lot of what you've described from your history indicates that's probably where we've got some spots where there's probably some consistent inflammatory stress coming from, right? Because your guts are a great place for infectious things to hang out and cause more problems, okay? So we started with a stool test, started doing some work in the guts that way, got them up to a detox. We did the detox, they did it, and they've been really good about keeping to what I've told them to keep with. Food allergies, stool tests, other life things. We went back and redid their stool test to measure, okay, what's changed? And they've had a lot of change, and it's great. But none of their infectious markers really changed. Their IgA increased. Okay, good, there's more immune response. That was really good, because their IgA sucked before. Their EPX was doing some weird stuff. I'm like, that's usually indicative of something kind of parasitic, or that's best taken care of by the body SWAT team. Like, that's kind of weird. And none of the bacteria budged. One of the really difficult ones is Citrobacter. That got moved out, but another one took its place. And you'll notice that on the post-test, it basically is the same. It's like, okay, look, what are we missing here? There's some kind of marker, there's some kind of component that hasn't been discovered. So we started going through a little bit more history, and it's like, wait a minute, that bacteria still is between these two spots, that hasn't changed, inflammatory markers. And I just looked at them and said, are you living in a moldy environment? And without pause, they said, oh yeah, it's in my basement. I'm like, what? Okay. No wonder we haven't made any progress. You're being constantly poisoned. Your system's being constantly weakened. It cannot heal inside of this inflammatory environment unless we do the proper things necessary to manage it. Now, are there some instances where a Wellness Way doc has gotten somebody to make great progress while they're in an inflammatory environment? Yes, but that person has to be very, very particular about doing certain things to try and effectively create an alternative environment inside of where they're at. Okay? Mold really messes people up because there's a whole bunch of different varieties. Mold is not just one thing. Okay? There's some mold that likes to live in a moist environment. That's what most people think of. But there's also mold that likes to live in dry environments, and that's what this person has going on. They have a dry environment loving mold that's living down there. And the stuff really doesn't need that much nutrition to survive. There's freaking microorganisms that are living inside of the ionizing radiation environment of nuclear reactors. Okay, let that sit for a moment. These things are very, very resilient. Okay, and don't you dare bleach them. That'll aggravate them and they'll just kick out more stuff. You actually need to use vinegar. So I looked at them and said, look, you need to get this stuff out of your environment or I can't do jack, okay? So when we're looking for stuff, when somebody's not seeing progress while they're under Wellness Way care, there's a missing piece. And it's by and large an immune trigger. What was this person's immune trigger? It was mold, okay? And I've been seeing a lot more of that pop up now, a lot more mold problems, and they show up in different ways. And mold's not always obvious in your home. And there's things that you can do to find it. What's called an ERMI test, E-R-M-I. They're really solid. They know what they're doing. They know how to test this stuff. And it's a really cheap test. A really cheap test to understand, can your body properly heal? Why is the whole family having respiratory problems when they're at home? You should probably check out for mold. And not everyone's going to have the same experience, right? Keep that in mind. Every body is going to be affected differently depending on its level of resiliency, right? How well can it maintain itself against an inflammatory stressor, like mold toxins. Ever heard of sick building syndrome? You should probably take a look at it. It's been around for a little while. It's just now actually getting some credit because the consistency is coming across more. And we're seeing that a lot more in the mold world now. The stuff is, yes, it's everywhere. We're always living with it. But we didn't always have such tightly sealed buildings with more opportunities for water damage and more places for water damage and mold to live than we ever have before. Our buildings are not well ventilated. Oh, but we have HVAC. Is it proper for what we're dealing with? Consider that. And in this person's instance, they had just enough water damage, but it's all dry. Yeah, mold can live in that. If mold can survive ionizing radiation, I'm pretty sure it can survive a dry environment. They need just a very tiny amount of carbohydrates in order to survive and reproduce. And what's one of their things that they do as they reproduce? They produce defensive things, like mycotoxins. And there's tests that we can run to see if your body has a mycotoxic load. Okay, very simple tests. We have that test because we know that there's a toxicity component that's present within that. And it can take about 1 to 2 years for someone that's being good on what they're doing for their body to properly eliminate that stuff. I've got a couple other patients where that's a very similar thing. One person where we were looking at their tests and they've been really good. They've been on top of stuff. I appreciate this patient because they're with it. And they've had a lot of improvement in their body, don't get me wrong. But they spent 5 years living in a moldy environment. And when we looked at their test, your white blood cells improved, but your hormones are still tanking out. Your liver's still doing some weird stuff. Like, what's going on here? Like, wait a minute, hang on a second. Are you living in a moldy environment? Were you in a moldy environment? It's like, right now, no. But I lived 5 years and we didn't know until the very end. The basement was we had black mold the whole deal. I'm like, oh, that's part of our problem. So we're waiting for their mycotoxin test to come back to see what's going on. Because every toxin is going to do a little bit of some different damage to the body. And there's a little bit of different ways to get each one out. So if you're not seeing progress in your health, or if you're having some really weird health problems, you need to get that kind of a test run, and you need to have someone that knows how to deal with some of this stuff differently. There's no medication in the world that busts up and moves out mold toxins. Not like what the body's capable of. You can never chemically replicate this system, okay? But you can support it so that it can perform normal function. And there's other ways and other indicators that exist on tests. Just go back to that stool test that we had earlier. Look at some of those bacteria. Look at what's there. There's patterns here. Look at the inflammation markers. There's patterns there. Look at how they're digesting and absorbing stuff. There's patterns there. Now, that's not always a mold problem, but the bacterial one, that one's pretty consistent. It's not 100%, but gosh dang, when you see that Klebsiella oxytoca, somebody either is currently being exposed to mycotoxins or their body has not eliminated the mycotoxins that they're exposed to. This is currently the story of my family. As I'm working with them, they were poisoned for at least 10 years by a house that was absolutely just riddled with mold, and they never found it until they looked in the attic. And it was some pretty toxic stuff. They're still dealing with the effects of that, the consequences of that on their body. I can still see it on their testing to this day, but we're working on that. So if you're not making progress, talk to one of us, get some testing done. Let's sort out why you're not healing.